Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Midazolam Injection, exploring the various aspects of midazolam, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Midazolam Injection. Midazolam Injection is a medication primarily used for its sedative, anxiolytic, amnestic, and muscle-relaxant properties. It belongs to the benzodiazepine class of drugs and is commonly used in the following clinical settings. Midazolam is often administered before surgical procedures to reduce anxiety and induce sedation. It is used during medical procedures such as endoscopy or minor surgeries to provide sedation, anxiolysis, and amnesia. It is sometimes used to induce anesthesia, especially in combination with other anesthetic agents. It can be used to manage acute seizures, including status epilepticus. It is also employed for sedation of mechanically ventilated patients in the ICU. Next, dosage of midazolam injection. The dosage of midazolam injection varies depending on the patient's age, weight, clinical condition, and the purpose for which it is being used. Let's discuss the general dosage guidelines for adults. For preoperative sedation, the dosage is 0.07 to 0.08 mg per kg IM, approximately 30 to 60 minutes before surgery. For procedural sedation, the dosage is 1 to 2.5 mg for administered slowly. Additional doses of 1 mg may be given if needed, not exceeding a total dose of 5 mg. For induction of anesthesia, the dosage is 0.1 to 0.2 mg per kg for administered over 20 to 30 seconds. For seizure control, the dosage is 2 to 4 mg for, repeat every 5 to 10 minutes if necessary, up to a total of 10 mg. Pediatric dosage are calculated by the weight and condition of the patient. Next, mechanism of action of midazolam injection. Midazolam works by enhancing the effects of gamma-aminobutyric acid, a neurotransmitter that inhibits activity in the brain. Specifically, midazolam binds to the GABA-A receptors, increasing the efficiency of GABA binding to its receptor. This action results in increased neuronal membrane permeability to chloride ions, leading to hyperpolarization and stabilization of the neuronal membrane. The overall effect is a reduction in neuronal excitability, producing sedation, anxiolysis, muscle relaxation, and anticonvulsant effects. Next, side effects of midazolam injection. Common side effects of midazolam injection include drowsiness and sedation, dizziness and lightheadedness, amnesia, nausea and vomiting, respiratory depression, hypotension, and injection site reactions. Severe side effects may include respiratory arrest, cardiac arrest, severe allergic reactions, and paradoxical reactions. Next, important advice for using midazolam injection. Midazolam should be administered by a healthcare professional experienced in the use of sedative medications. Continuous monitoring of respiratory and cardiovascular status is essential. Dosage should be tailored based on the patient's age, weight, medical condition, and response to the drug. Elderly patients and those with significant comorbidities may require lower doses. Patients should avoid consuming alcohol or using other central nervous system depressants, as they can enhance the sedative effects of midazolam and increase the risk of respiratory depression. Use caution in patients with chronic respiratory diseases, compromised airway, or those with a history of substance abuse. After administration, patients should be monitored for a sufficient period to ensure they are fully alert before discharge, particularly if they are to operate machinery or drive. Resuscitative equipment and medications to manage respiratory depression and hypotension should be readily available when administering midazolam. Use in pregnancy should be avoided unless clearly necessary. Midazolam can pass into breast milk, so caution is advised for breastfeeding mothers. Midazolam can interact with other medications, especially those metabolized by the liver enzyme CYP3A4. Careful consideration and adjustment of dosage may be necessary when combined with such drugs. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using midazolam injection. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.